I'm Stephen Lipshultz, and I'm a professor of pediatrics at the University at Buffalo, Jacobs School of Medicine and Biomedical Sciences in Buffalo, New York. And I'm a pediatric cardiologist with a focus on cardiomyopathy, heart failure, and related to genetics, related to toxic exposures such as chemotherapy, and related to inflammation and infections. My journey into pediatrics and what inspired me to pursue this field is it's been a real privilege to really help improve the future. By that I mean, in the United States, for example, are 75 million school-aged children, and they are an abundant treasure. And while they're only 24% of the US population, they're 100% of our future. And their future will be our legacy. And the same is true for children throughout Europe and adolescent young adults throughout Europe who may be at risk for or with acute and chronic medical issues where we can make a difference. And this is where my journey was inspired to try to give the highest quality of life for these children and their families across their lifespan. The advice that I would give to young professionals just starting their career in pediatrics is that there's opportunities all over to improve health, improve quality of life, improve outcomes by working with families, working with parents, working with and listening to children, doing advocacy, and doing discovery. And my advice is it's as fulfilling as it can be and a privilege for people to have the opportunity to go into this field. Some of the details of the projects we've been currently working on and how they're contributing to the advancement of pediatric care include, for example, in the field of childhood and adolescent cancer, one of the greatest miracles of pediatric medicine in the last 50 years has been the improvement in event-free survival of these oncology patients. But for many of them, the price of a cure is toxicities and late effects. Some of our current work and our focus over decades has been to identify that cardiovascular complications of cancer and its therapy during childhood is one of the leading causes of morbidity and mortality in survivors. And we've been pleased over the years to get improvements by understanding the course, the risk factors, and the highest risk groups by validating biomarkers as predictors of outcome. And as a result, we've been able to do a number of clinical trials, and a medication that we brought from bench to bedside called dextrazoxane is now being used increasingly around the world for children with cancer to reduce these cardiac complications of chemotherapy. In the field of genetic causes of cardiomyopathy, unhealthy heart muscle, we've been extensively looking at certain gene mutations that might really predispose children and adolescents to developing cardiomyopathy or unhealthy heart muscle, leading to heart failure and need for heart transplant. And some of these mutations are more prevalent in certain groups of children and are associated with adverse outcomes. And our ability to do more genetic screening early to help predict which children may need more supports because they have a quite pathologic set of mutations is a big part of our work. Our third area of active research is for children with immune activation and chronic viral infections in terms of how this can affect and reduce not only quality of life, but increase epigenetic age. And along those lines, we have come up with certain immunomodulatory therapies that can really change the course. So in all of these areas, we've been very excited that a lot of the projects we continue to work on and lead as clinical studies and clinical trials around the world are leading to improvements in pediatric care and outcomes. There are three presentations that I'll be involved with. One is in the setting of the long-term toxicity of childhood cancer therapy, really focused on pediatrics and practice. I will be presenting on some of the cardiac and cardiovascular complications and really focusing on what to expect, how that changes over time, what is the course of these, what are the risk factors for developing this, what may be the most effective treatments, and which biomarkers could be useful in terms of identifying and diagnosing and managing cardiac complications. The second presentation is one scheduled in a session related to pediatrics and practice on updating the genetic susceptibility to pediatric diseases. And in this particular session, I'll be focusing on the cardiology perspective. How does gene screening lead to better understanding of cardiomyopathies during childhood and adolescent and young adults? What is the role of genetic screening? How does that change management? And so that's my second area of presentation. And then I will also be involved with a table session on training mobility, why, when, and where, to informally chat with junior members of the audience to share some of my experiences. The format of the EAPS 2025 meeting of Uniting Expertise in Advancing Care is really an ideal way to implement discovery best practices and lead to the highest quality of life for children, adolescents, young adults, and their families over a lifespan. I'm most looking for, with EAPS 2025, for this horizontal integration, this discussion crossing disciplines, never losing track of those that were privileged to serve, the children and their families, and sharing that research is fundamental to improving health for these special populations, and that in recent decades it's resulted in substantial progress in reducing death, improving lifespan, health-related quality of life worldwide. But there's still many gaps, and a meeting like this, bringing together primary care and specialty pediatrics, really helps share successes, advances, understand gaps and issues, and really be even more focused on preventable conditions affecting our patients. And for these reasons, it's an exciting meeting. The message I'd like to share with the pediatric community is that we need to focus on precision genetic, genomic medicine, and personal health histories to create therapies for individual patients, including gene-based therapies. We need to enhance preventive medicine to transform healthcare systems from illness to prevention and wellness by better understanding disease modifiers. And all this will lead to better management and implementation. By doing this, health is our outcome, not disease, and working together just works.